While you are reading this, your dog is actively using an ancient evolutionary program to hide a potentially fatal illness from you. And by the time they show a single symptom, it is usually too late. Think about that for a moment. If you wake up with a sharp, stabbing pain in your abdomen, you can pick up the phone and call a doctor. If you have a pounding, relentless headache, you can tell your family exactly how you feel. But our dogs cannot speak. They cannot tell us when an infection is brewing or when a silent, aggressive tumor is growing inside them. Instead, they carry on. They greet us with a wagging tail, devour their dinner, and curl up next to us on the rug. Everything looks absolutely flawless. But underneath that joyful, energetic exterior, a silent clock could be ticking. A tumor could be expanding on their spleen. An insidious kidney failure could be draining their cellular hydration. A quiet, progressive heart valve leak could be starting to pool fluid in their lungs. And yet, silence. Not a single whine, not a single complaint. Then, the unthinkable happens. You wake up on a normal morning, and your best friend suddenly cannot stand up. Their gums are pale. Their breathing is shallow, and you find yourself rushing down the highway in a state of absolute, heart-stopping panic toward the emergency clinic. You sit in that cold, sterile lobby, clutching a leash, tears streaming down your face, asking yourself the most painful question any pet parent can ever face. How on earth did I miss this? Let me free you from that heavy, suffocating burden of guilt right now. You missed it because your dog is a biological master of deception. They are programmed to lie to you. It is not because they do not trust you. It is because their DNA is still echoing with the brutal, unforgiving laws of the wild. Before dogs slept on orthopedic beds in air-conditioned homes, they were wild pack predators. In the wild, the rules of survival are absolute. If a wild canine shows even a minor weakness, if they limp, if they whine, or if they slow down, they instantly become a liability. They attract larger, apex predators to the pack. They lose their social status. Or worse, they get left behind to face the elements alone. Even though your dog knows they are safe, primitive instinct forces them to wear a mask of health. They will look you dead in the eye and pretend everything is perfectly fine, even when their body is fighting a massive internal battle. My name is Katja Berger. As an expert who has spent years analyzing animal health, I have stood beside thousands of heartbroken families in those moments of crisis. I have heard the quiet sobs. I have seen the devastating shock. And I realized that the traditional way we monitor our pets' health is fundamentally broken. We wait for them to show us something is wrong. But by the time a dog actually stops eating, whines or collapses, the underlying disease is already incredibly advanced. Waiting for obvious symptoms is a highly dangerous gamble where the stakes are your best friend's life. But what if you did not have to play that game? What if you possessed a direct, clear wind into their internal physiology? Today, I am going to share a powerful veterinary secret with you. I am going to teach you how to perform what I call the evening at-home exam. This is a simple, highly precise, and deeply relaxing routine that you can integrate seamlessly into your life while you are simply winding down on the couch watching television. It takes no more than 2 to 3 minutes of your time. To your dog, it feels like a luxurious, comforting massage. They will lean into your touch, completely relaxed, soaking up the affection. But in reality, your hands will be performing a sophisticated medical screening. By the time we finish today, you will know how to decode their vital signs, like a professional. You will learn the hidden language of their gums, how a simple 5-second pressure test reveals their cardiovascular status, and why the shape of their ear canal hides dangerous infections. We will look at how to detect dehydration, how to map their body for swollen lymph nodes, and how to check their breathing rate to catch heart failure early. We will even dive deep into their paws to find the tiny migrating assassins that most owners never even think to look for. This is not about complex veterinary school jargon. This is about real, actionable, life-saving knowledge that puts the power back into your hands. Grab a notebook. Get comfortable on the sofa. Pull your dog up beside you. Let us strip away the helplessness and learn exactly how to protect the one who loves you unconditionally before it is too late. Let me paint a picture for you. It is a quiet Tuesday evening. You are sitting on your sofa, and your 8-year-old Labrador, Max, is lying on the rug. He seems completely fine. Maybe he is slightly more tired than usual, but you dismiss it. He is getting older, right? You notice him lick his lips once or twice. He walks over to his water bowl, takes a long, slow drink, and then sighs as he lies back down. It looks like a picture of pure domestic peace. But inside Max's abdomen, a biological catastrophe is unfolding, a silent, highly aggressive tumor on his spleen. A hemangiosarcoma has just developed a microscopic tear. The spleen is a highly vascular organ, essentially a giant sponge holding a massive portion of your dog's blood supply. For months, this tumor has been growing without a single outward sign. Max did not lose his appetite. He did not limp. He did not whine. But right now, at this very second, a slow, steady trickle of blood is escaping his spleen and pooling into his abdominal cavity. Max's body is desperately trying to compensate. To maintain blood pressure to his brain and heart, his spleen contracts, pushing its remaining reserves into circulation. His heart rate increases slightly. His blood vessels constrict. He is running on pure, adrenaline-fueled survival mode. To you, he just looks a little sleepy. To a trained veterinary eye, he is actively compensating for internal bleeding. By tomorrow morning, the compensation mechanisms will fail. The blood loss will overwhelm his system. Max will collapse on the kitchen tile, unable to lift his head, his gums the color of stark white paper. You will rush him to my clinic, but by then, the surgical window is closing rapidly. The damage is done. This is not a rare, one-in-a-million scenario. This is a daily reality in veterinary emergency rooms worldwide. Let us look at the brutal statistics. According to the Veterinary Cancer Society, 1 in 4 dogs will develop neoplasia, cancer, at some point in their lives. For dogs over the age of 2, cancer is the single leading cause of death. If your dog is over the age of 10, those odds skyrocket to an unbelievable 50%. Half of all senior dogs will face this battle, and it is not just cancer. Chronic kidney disease affects an estimated 10% of all dogs during their lifetime. But here is the catch that terrifies veterinarians. The kidneys are incredibly resilient, but they are also silent sufferers. A dog's body can function completely normally with 50% kidney damage. It can even function with 60%. In fact, you will not see a single physical symptom of kidney failure. No increased thirst, no weight loss, no changes in urination, until a staggering 75% of their kidney tissue is permanently, irreversibly destroyed. Think about that. By the time your dog shows you they are sick, 3/4 of their kidney function is already gone forever. You are not catching the disease. You are merely managing the wreckage. Why do we miss these signs? Because the human brain is wired to look for obvious, dramatic signals of distress. We wait for the scream, the limp, the refusal to eat. But in the canine world, pathology behaves like a master of stealth. What we perceive as innocent, everyday quirks are often the smoke signals of a raging internal fire. Take paw licking, for example. How many times have you watched your dog lick or chew their paws and thought, oh, they are just cleaning themselves, or it is just a little itch? Here is what is actually happening at a biological level. A dog's paw pads are one of the very few places where they possess sweat glands. When a dog experiences a systemic allergic response, whether to environmental pollen, storage mites in their kibble, or a specific protein, their immune system releases a massive flood of histamines. These histamines migrate directly to the highly vascular areas of the body, particularly the skin folds, ears, and the delicate webbing between their toes. This causes intense localized pruritus, a scientific term for severe itching. The dog licks to soothe the burning sensation. But the friction of their rough tongue, combined with the moisture of their saliva, strips away the skin's natural lipid barrier. Now the warm, dark, damp spaces between their toes become a perfect biological incubator, the natural, harmless yeast population on their skin. Specifically, an organism called Malassezia begins to multiply exponentially. The yeast feeds on the moisture and the lipids. As the yeast overgrowth takes over, it releases enzymes that further damage the skin barrier, creating a vicious cycle of itching, licking, and secondary bacterial infection. By the time you notice a red, raw paw or a faint corn chip smell, your dog has been living with a raging, painful fungal and bacterial war zone on their feet for weeks. They have been in constant, irritating discomfort while pretending everything is completely normal. Or consider the simple act of heavy breathing or minor panting while resting. Your dog is lying on the cool tile floor, panting softly. You assume they are just warm from a walk or a bit excited. But what if they have been resting in a cool, air-conditioned room for hours and their respiratory rate is still elevated? Inside their chest, a silent progressive condition known as mitral valve disease may be escalating. The mitral valve is the gatekeeper between the left atrium and left ventricle of the heart. Over time, particularly in small to medium-sized breeds, this valve can wear out, thicken, and fail to close properly with every single heartbeat. Instead of all the blood pumping forward into the body, a small amount of blood leaks backward through the faulty valve, creating a turbulent flow we call a heart murmur. Initially, the heart compensates by stretching and thickening its muscle walls. But eventually, the pressure backs up. It travels backward into the pulmonary veins, the blood vessels that drain the lungs. This high pressure forces fluid to literally leak out of the microvasculature and pool into the tiny air sacs of the lungs, the alveoli. This is pulmonary edema. Your dog is quite literally slowly drowning from the inside out because they cannot expand their lungs fully. Their brain detects a drop in oxygen saturation. To compensate, their nervous system forces them to take faster, shallower breaths to keep their vital organs alive. The dog will not cough. They will not cry out. They will simply lay there, breathing 40 times a minute instead of 20. They are working twice as hard just to extract enough oxygen from the air. If you do not know to count those breaths while they sleep, you will miss the entire window of opportunity where simple daily cardiac medications could have stabilized that valve, reduced the fluid, and extended their life by years. This is the terrifying reality of pet ownership. The enemies our dogs face do not march in with trumpets sounding. They slip in through the back door, quietly dismantling their organs, their joints, and their immune systems, while our best friends look us in the eye, wag their tails, and pretend everything is perfect. We cannot rely on them to tell us when they are hurting. We have to actively go looking for the truth. Now, let us expose the uncomfortable truth. Why do standard, highly marketed methods sold in pet stores, or the endless advice floating around on social media, fail so spectacularly? Why do they so often make the underlying health crisis worse? The reality is that 99% of dog owners make one critical daily mistake. They treat the superficial symptom while completely ignoring the biological root cause. Let us start with the ears. When an owner notices their dog shaking their head, scratching their ear, or emitting a musty odor, their first instinct is often to drive to the nearest pet superstore. They walk down the aisles and pick up an over-the-counter ear cleaning solution. These products are frequently formulated with harsh alcohols, heavy artificial fragrances, or highly acidic drying agents. Here is why this is a recipe for disaster. The delicate lining of a dog's ear canal is incredibly sensitive. If that ear is red and inflamed, it is because the protective epithelial barrier has been compromised. Pouring a harsh alcohol-based cleaner into a raw, inflamed ear canal causes agonizing, burning pain. The dog screams, runs away, and learns to associate ear handling with torture. But it gets much worse. Remember the anatomy we discussed. The canine ear canal is shaped like the letter L. It goes straight down vertically, then takes a sharp 90-degree horizontal turn towards the eardrum. When you squirt a liquid cleaner into the ear and simply wipe the outer flap with a cotton ball, you are not actually cleaning the ear. Instead, you are liquefying the deep wax-laden debris at the top of the canal, and gravity is washing it straight down, where it settles at the very bottom of the horizontal canal, resting directly against the fragile tympanic membrane. The eardrum. If the eardrum has already been weakened or ruptured by a deep bacterial infection, that chemical cleaner, along with all the dissolved, bacteria-ridden wax, will leak directly into the middle and inner ear. This can cause permanent, irreversible deafness, facial nerve paralysis, or vestibulocochlear damage, leaving your dog permanently off balance, tilting their head, and suffering from severe neurological pain. Yet, millions of owners dump these fluids down their dog's ears every single day, completely unaware that they are driving the infection deeper and risking their dog's neurological health. The second massive mistake is the abuse of over-the-counter anti-itch shampoo and topical hydrocortisone sprays. When a dog is chewing their paws, rubbing their face on the carpet, or scratching their flanks, the owner buys a cheap oatmeal shampoo or an over-the-counter steroid spray. Let us break down why this is a critical scientific error. At a cellular level, itching is a systemic immune response. It is a signaling pathway driven by inflammatory cytokines, specifically interleukin-31 or IL-31. When your dog has an allergic reaction, their body releases IL-31, which binds directly to receptors on the sensory neurons in their skin. This sends a rapid, high-speed message to their brain that reads as an intense, agonizing itch. Washing the outside of the hair coat with oatmeal does absolutely nothing to stop this internal cytokine-driven signaling cascade. It is like trying to put out a roaring house fire by spraying a garden hose on the mailbox. It might feel slightly cool to the touch for exactly 5 minutes, but the moment the skin dries, the internal fire continues to rage. Worse yet, many of these cheap shampoos contain synthetic chemicals and preservatives that strip away the skin's remaining natural sebum, the essential lipid barrier that protects the body from external pathogens. By stripping this barrier, you are quite literally opening the floodgates. You are inviting environmental allergens, microscopic mites, and opportunistic bacteria like Staphylococcus pseudointermedius to penetrate deep into the hair follicles, transforming a simple, manageable allergic itch into a deep, painful systemic skin infection that requires weeks of heavy, internal antibiotics to cure. And then we have the dangerous world of topical hydrocortisone sprays. Owners spray these steroids directly onto red patches of skin, thinking they are reducing inflammation. But steroids are powerful immunosuppressants. If that red patch of skin is actually a localized ringworm infection, which is a highly contagious fungus, or a localized bacterial hotspot, spraying a steroid on it is like turning off the security alarms in a bank during a robbery by suppressing the local immune response in the skin. The steroid prevents the dog's white blood cells from fighting off the invading pathogens. The fungus or bacteria, now completely unchecked by the body's natural defenses, explodes in population, turning a tiny dime-sized spot into a massive weeping, oozing lesion within a matter of 48 hours. But perhaps the most dangerous daily mistake of all lies in the home treatment of pain. An owner notices their senior dog is slow to rise from their bed or limps slightly after a walk. They think, I want to help them feel better, so they open their medicine cabinet and pull out a human painkiller. Maybe it is ibuprofen, maybe it is naproxen, or maybe it is a standard aspirin. This is a highly lethal decision. A dog's physiology is completely different from ours. Humans possess specific liver pathways and protective mechanisms in our gastrointestinal tract that allow us to process non-steroidal anti-inflammatory drugs, or NSAIDs, relatively safely. Dogs do not. When a dog ingests even a tiny fraction of a human NSAID like ibuprofen, it rapidly blocks an enzyme called cyclooxygenase 1, or COX-1. This enzyme is responsible for producing prostaglandins, which are critical signaling molecules. Prostaglandins do 3 essential things. They maintain blood flow to the kidneys, they regulate systemic blood pressures, and they produce the thick, protective mucus barrier that prevents highly acidic stomach acid from digesting the stomach itself by blocking this enzyme. Human NSAIDs instantly halt the production of this protective stomach mucus. Within hours, the dog's own highly concentrated stomach acid begins to eat through the lining of their stomach, creating massive bleeding ulcers. The dog begins vomiting dark, digested blood that looks like coffee grounds. Simultaneously, the blood flow to the kidneys drops to near zero, causing acute, catastrophic renal necrosis, the rapid death of kidney cells, by trying to solve a simple joint ache with a human pill. You can cause your dog's kidneys to permanently shut down and their stomach to rupture, all within a single afternoon. These standard, unscientific, quick fix retail and home methods do not work because they are built on a fundamental misunderstanding of canine biology. They are superficial band-aids that frequently mask critical warning signs, delay proper veterinary diagnosis, and introduce dangerous new toxins into an already compromised system. If we want to truly save our dogs' lives, we must stop guessing, stop trusting retail marketing, and start looking at the precise, scientific truth of their internal physiology. This is where we take back control. We are going to replace fear and speculation with a highly structured, scientifically sound, and entirely free daily habit. I call this the veterinary evening at home protocol. To your dog, this is simply the most relaxing, comforting, physical routine of their day, a luxurious, loving massage on the couch. But to you, it is an incredibly precise 7-step clinical screening algorithm that will allow you to catch silent illnesses weeks and in some cases months before they escalate into an emergency. Here is your exact step-by-step evening examination roadmap. Step 1. The lip flip and capillary refill test, perfusion check. While your dog rests their head on your knee, gently place your hand over their muzzle and lift their upper lip. You are inspecting the mucous membranes of the gums above the canine tooth. The baseline. Gums must be a rich, bright, bubblegum pink. The tissue should feel slick and moist to the touch. The action. Take your index finger and press firmly directly onto the pink gum tissue for exactly 2 seconds. Release. A white fingerprint will remain. The timing. Count the seconds it takes for the pink color to rush back into that white spot. This is the capillary refill time, CRT. The interpretations. Under 2 seconds. Perfect. This indicates excellent cardiac output. strong blood pressure, and optimal tissue perfusion, greater than 2 seconds. This is a major warning sign. Your dog's vascular system is struggling to deliver blood to the periphery. This indicates severe dehydration, cardiovascular depression, or impending shock, stark white or pale gray gums. This is an absolute, non-negotiable emergency. Your dog is either profoundly anemic or actively bleeding internally from a ruptured tumor or splenic crisis. Do not wait. Drive to the clinic immediately. Step 2. The ear check and safe. Outer ear, cleanse and gently fold your dog's ear flaps backward to expose the entrance to the ear canal. C. The visual check. Look for deep redness, dark brown debris resembling coffee grounds, ear mites, or yellow-green discharges. The sniff test. Lean close and smell the ear. A healthy ear is completely odorless. A sweet, yeasty corn chip odor indicates a Malassezia fungal flare-up. A sharp, pungent, sour odor indicates a deep bacterial colonization. The home solution sips. Never squirt liquid cleaners deep into the ear canal unless a veterinarian has verified the tympanic membrane eardrum is fully intact. Instead, use this safe, preventative outer ear hygiene method. The recipe. Mix equal parts organic apple cider vinegar and purified water. A 1:1 ratio. Apple cider vinegar contains acetic acid, which naturally disrupts the alkaline environment that yeast and bacteria require to multiply. The application. Saturate a clean cotton pad, never a Q-tip. With the solution. Gently wipe only the visible, inside surfaces of the ear flap and the very entrance of the canal. This removes surface yeast buildup without forcing debris down the L-shaped canal or risking eardrum damage. Do this once a week if your dog is prone to itchy ears. Step 3. The skin turgor test. Hydration level. Locate the loose skin at the base of your dog's neck, right between their shoulder blades. The action: gently grasp a fold of this skin, the scruff, and pull it upward toward the ceiling, creating a temporary skin tent. Release it instantly. The interpretation: immediate snap back, 1 second, perfect hydration. The interstitial fluid layers are plump with water, maintaining high skin elasticity. Slow, sluggish crawl back, 2 to 5 seconds. Moderate to severe dehydration. The home solutions. If your dog repeatedly fails the skin tent test but is otherwise acting normally, their body is losing fluid at a cellular level, a common early sign: metabolic stress, kidney strain, or silent fever. Do not use human electrolyte drinks like Gatorade. These often contain safe for human but highly toxic for dogs sweeteners like xylitol, or inappropriate sodium to potassium ratios. Instead, brew a highly hydrating, low-sodium bone broth at home. Simmer beef marrow bones in water for 12 hours with a tablespoon of apple cider vinegar to draw out nutrients. Allow it to cool, skim the fat entirely off the top, and add 2 tablespoons of this nutrient-dense broth to their water bowl. The amino acids and natural gelatin will dramatically increase their drive to drink, restoring cellular hydration naturally. Step 4. The lymph node. Meet with your dog relaxed. Use the flat pads of your fingers in a gentle, circular, rolling motion. You must palpate both sides of their body simultaneously to compare symmetry. Submandibular nodes. Slide your hands under the corner of the lower jaw, where the neck meets the jawbone. You are looking for symmetrical, hard, grape-sized lumps. Prescapular nodes. Feel the flat area directly in front of their shoulder blades at the base of the lower neck. Popliteal nodes. Slide your hands down the back legs and feel the soft, hollow pocket directly behind the knee joint. The action. In a healthy dog, these nodes are completely undetectable or feel like tiny, soft, slipping peas. If any of these locations reveal a hard, non-painful, walnut-sized or golf ball-sized mass, book a veterinary visit immediately. Finding these early is the single most critical factor in successfully managing lymphatic cancers. Step 5. The abdominal sweep. Slide your flat hand gently along your dog's flank, just behind the rib cage. The assessment: press incredibly gently. The belly should feel soft, pliable, and easily compressible, like bread dough. The warning: if the abdomen feels hard, tightly distended like a drum, or if your dog tenses their muscles, groans, or tries to turn and bite your hand, they are experiencing acute abdominal pain. This can indicate gastric dilatation volvulus, bloat, or a severe internal blockage. If accompanied by unproductive retching or pacing, treat this as a life or death emergency. Step 6. The sleeping respiratory rate. This step requires absolutely no physical touch. Wait until your dog is in a state of deep, peaceful sleep. Their body must be completely motionless, not dreaming, twitching, or running in their sleep. The action: watch their chest rise and fall. One full rise and one full fall equals exactly 1 breath. Set a timer on your phone for 60 seconds and count the breaths. The baseline: a Gauss should take fewer than 30 breaths per minute. Most healthy dogs average between 15 and 25. The metric: keep a small log of this number on your phone. If you notice their sleeping respiratory rate steadily climb from a normal 18 breaths per minute up to 30, 35, or 40, fluid is beginning to accumulate in their lungs. This is the earliest, most reliable preclinical indicator of congestive heart failure. Catching this now allows your veterinarian to prescribe mild cardiac support drugs, extending your dog's life ounce by months or even years before they ever suffer a terrifying fluid-filled coughing fit. Step 7. The toe spread and yeast buster soak. Flip your dog's paw over so you are looking at the underside of their pads. Gently use your thumbs to spread the hairy webbing between each toe completely apart. What to look for: redness, brown staining, a greasy texture, or any hard, raised nodules, mast cell tumors. Check for the entry hole of a migrating grass seed or foxtail, the home solution for yeast itching. If you find red, itchy, yeast-scented paws, do not let them chew. Use this highly effective biological foot bath. The recipe: fill a shallow tub or sink with warm water up to your dog's ankles. Add chlorhexidine solution, available over the counter as Hibiclens or veterinary 2% chlorhexidine, until the water is light blue. Alternatively, if the skin is not raw, red, or broken, use a raw organic apple cider vinegar soak, diluted 1 part vinegar to 10 parts warm water. The protocol: stand your dog in this bath for exactly 2 minutes. The chlorhexidine or vinegar will completely dismantle the cellular walls of the overgrowing yeast and bacteria. The crucial step: lift each paw and dry the webbing completely with a clean towel. Moisture is the lifeblood of fungus. Removing the moisture starve the remaining yeast, halting the itching loop immediately. By incorporating these 7 simple steps into your nightly routine, you are shifting your entire approach to pet ownership. You are no longer a passive observer waiting for disaster to strike. You are an active, highly informed guardian of your dog's health. You have bypassed their evolutionary poker face and looked directly at the physical truth. My name is Katja Berger. My name is Katja Berger. I want you to remember that the greatest gift we can give our dogs is not just our love, but our vigilance. They spend their entire lives protecting us, keeping us company, and bringing pure, unadulterated joy into our homes. The very least we can do is use our hands, our eyes, and our minds to protect them in return. If this deep, clinical guide has empowered you to become a more confident, proactive pet parent, please show your support. Hit that like button right now to help this vital information reach other owners who need to see it. Click that subscribe button to join our dedicated community of animal guardians. And share this video with someone you love who has a dog. Let us protect our best friends together.